We invite you to read our review on the top advances in targeted therapies for patients with lung cancer in 2023. Here we focus on clinical trials that are shaping the treatment landscape for patients with oncogene-driven lung cancer. In this review, we report on recent advances in the adjuvant setting, where trials of osimertinib and alectinib have recently demonstrated overall and disease-free survival benefits, respectively, in the postoperative setting for patients with early-stage lung cancer. We do think the field should consider how these adjuvant strategies might benefit patients with other oncogene-driven lung cancers, where we see benefits in the metastatic setting.
EGFR mutant advanced non-small cell lung cancer, we highlight trials focused on intensifying upfront therapy for patients with common EGFR mutations. We continue to see a shift towards intensifying therapy in the first-line setting. However, the challenge will be determining the optimal treatment sequencing of patients and identifying those patients who will benefit most from some of these approaches while managing the added toxicities that are always going to come from combination therapies.
We also discuss multiple trials that have shown clinical efficacy for several targeted therapies, some of which have led to recent FDA approvals, for example, for patients with BRAF V600E mutations and ROS1 rearrangements. And we provide updates on the efficacy of targeted therapies for patients with RET rearrangements and MET exon 14 skipping mutations.
For patients with KRAS mutant non-small cell lung cancer, we highlight recent trials of the KRAS-on inhibitors, which are showing encouraging early signs of clinical efficacy.
In a mechanism of resistance agnostic way, antibody-drug conjugates, including patritumab deruxtecan and TROP2 targeting ADCs, are showing promising activities for patients with EGFR mutations and other genomic alterations.
We look forward to a rapidly evolving field of both targeted therapies and antibody-drug conjugates that is continuously offering lung cancer patients with new therapeutic options.